Welcome! Today we're going to talk about patient-centered primary care homes, what they are, and how your clinic can become one. A patient-centered primary care home, or PCPCH for short, is a clinic or healthcare practice that has been recognized by the Oregon Health Authority for its commitment to providing high-quality, patient-centered primary care. PCPCHs are basically Oregon's version of primary care medical homes, which practice a model of care that focuses on coordinating the full scope of patients' preventative care needs, improving the quality of care over time, and building strong relationships with patients and their families to better care for the whole person. Oregon created the PCPCH program and model as part of the state's strategy to achieve what's called the Triple Aim, or the goal of improving people's experience with healthcare, improving the health of the entire population, and decreasing the costs of healthcare overall. And sure enough, since the program started back in 2009, studies have shown that PCPCHs do improve care and reduce costs by catching problems early, focusing on prevention and wellness, and managing chronic conditions. Over the past decade, clinics all across the state of Oregon have joined the PCPCH program and are now part of a community of hundreds of practices dedicated to improving the care they provide to their patients. This graphic shows the core attributes that all PCPCHs work towards. They strive to provide a comprehensive range of healthcare services, to build a continuous relationship with patients over time, to be accessible in the ways their patients need, to hold themselves accountable to quality care through continuous review and improvement, to coordinate the various types of care that their patients might need, and, as the name of the program suggests, to put patients and their families at the center of their practice's culture, operations, and improvement efforts. Equity is the foundation of all of these attributes, meaning that PCPCHs work to provide all their patients with the same access to care and the means to achieve health, regardless of diverse backgrounds or circumstances. So how can your clinic or practice become recognized as a PCPCH? Well, the Oregon Health Authority's PCPCH program has a list of standards of care that span all of the core attributes we just saw. Standards such as coordinating behavioral health referrals or using a certified EHR. Many of the standards contain multiple levels, also known as measures, that describe various activities that your clinic could be doing related to a specific area of care. Some of these measures are required for all PCPCHs, called must-pass measures, and others are optional but are worth a certain amount of points. To become a PCPCH, your clinic must be meeting all of the must-pass measures, be meeting enough of the optional measures to receive the minimum number of points, and for most practices, must have been providing primary care for at least 1 year. The PCPCH program publishes a document called the Recognition Criteria Technical Specifications and Reporting Guide, or TA Guide for short, which contains everything about the model, including details on the must-pass and optional standards, the minimum points and tier levels of recognition, and other important eligibility criteria. All clinics applying for PCPCH recognition are expected to have read through this document before applying. Keep in mind that the program does release updated versions of the model every few years, so make sure that you're using the right version of the TA Guide. Once you've read through the TA Guide and feel like your clinic is meeting the minimum criteria, you can apply for PCPCH recognition online by clicking on the Become Recognized section of our website, which will give you application instructions. In the online application, you will attest to meeting various standards and measures. Some of the standards will require you to provide some additional information or data in order to attest. You can save each page of the application, so you can take as long as you need to collect the necessary information and fill it out over time. There is also a self-assessment tool available on our website if you want to be able to see the application questions ahead of time and estimate how many points your clinic will be attesting to. That resource, along with other helpful tools, templates, and additional guidance around various PCPCH standards, is included on the Resources and Technical Assistance section of our website. As As you're applying, the PCPCH TA Guide will be your go-to resource for questions about whether you are meeting a standard or not. In the specifications for each measure, you'll notice a section called Documentation Required at a Verification Site Visit. As a participant in the PCPCH program, your clinic automatically agrees to a potential site visit from our program. Clinics are randomly selected for these visits, which is when our staff review your clinic operations to make sure you're meeting the standards and measures attested to. During one of these visits, you would need to provide the documentation listed in that section for each measure you attest to. So while we don't require you to provide it during the online application itself, we highly recommend compiling and saving that documentation while you are attesting to each standard to make sure that you can provide it if your clinic was ever selected for a site visit. You can learn more about our verification site visits under the Providers and Clinics section of our website. Once you've submitted your application, it typically takes 1 to 2 months for the PCPCH program to review it. We will let you know if we need any additional information from your clinic during this time. If everything looks good to go, then your clinic will be recognized effective as of the date you submitted a complete application with all necessary information included. You will then receive an official letter of recognition and certificate from the Oregon Health Authority that you can post in your clinic, share on your website, or share with interested payers. The letter and certificate will include your clinic's tier level under the program, which is determined by your points, aka how many of those optional measures you attested to. Once your clinic is officially a patient-centered primary care home, what happens next? Well, because of the improvements in costs and care associated with PCPCHs, coordinated care organizations and some private payers offer financial incentives for being recognized. So we encourage you to reach out to the payers you contract with to see what sort of incentives they might offer. It's also important to keep in mind that all PCPCHs are required to reapply for recognition at regular intervals to make sure that they are still practicing the model over time. Typically, it's once every 2 years that a clinic needs to reapply, but there are sometimes changes to that schedule, and the program will let you know what your official reattestation deadline is in the recognition letter that you receive. So make sure to check for that date and keep that letter for your records. Finally, we recommend signing up for our PCPCH program updates, which is a monthly email that includes important updates about the standards, opportunities for technical assistance, and other resources. We hope that you consider joining the program, and we are always happy to answer any questions you have about the process or specific standards. You can find our email and other information on our website. Thank you.